Well,
Okay.
Doc,
Now,
what we have now is an MCQ. No, what you were asking for is an MCQ, a medical community quarantine. You call it a medical quarantine.
We call
Now
it.
we have an MECQ, which is a reversion to something we had before June. Oh, by the way, see, Ami Paminto is now online with us from the Philippines. But
Good
Doc,
evening.
with the MECQ, do you think at least a good part of the concerns have been addressed, or hindi pa rin?
Okay, let me just clarify. What we're calling for is a demilitarized medical quarantine. The operative word is medical. It defines what quarantine is. And why we put demilitarized is because we want it to be entirely different from the current crop of iterations of community quarantine that has been imposed to us. We look at ECQ and down the line to your MGCQ. Those are just varying degrees of the same thing. You're just removing various levels of restrictions. But the entire approach to the quarantine itself and the way the quarantine is placed within the entire COVID response has not changed. It's still being led by the military. It's still being punitive. It's still being addressed as though the problem of, instead of looking at a public health problem, we're looking at a discipline problem. And the way the narrative is being said is totally different from what the data is saying us. What the data is telling us. Go ahead, please.
When you say that the approach should be different, that seems to be clear. I think people understand that. But what would it look like in practical terms? What would it look like structurally in terms of the people and the appointments, say, to the IAF and how the reports are made? Break it down for us. What would it look like demilitarizing, as you said, this approach, and in terms of putting in place the structure?
Yeah, thanks, Robbie. Thanks, Robbie. That's why we have not just a definition of a medical quarantine. That's why we also propose a 6-point action plan that aligns itself with the 6 pillars of our healthcare system. And that begins with the most important pillar, which is leadership. We cannot be run by a weak Department of Health Secretary and surrounded by the entire pandemic approach being run by generals and SARS. We need to be led by those with the health and related field backgrounds. And then they're working as a team. And then there has to be, at the start, a very clear, systematic plan that unifies the entire healthcare system under a single command. Hindi pwedeng yung private sector and the public sector are going their separate ways. Everybody has to be on the same page facing the pandemic. That's in terms of leadership. And then you're talking about we should be getting health workers, doctors, nurses, hiring them with aggressive recruitment policies and actions. Because right now, everything's knee-jerk. And if we look at the current plan, they want to get doctors from other places. They're actually getting from the same pie. They're just moving it around. And when they do that, those places with no COVID cases yet, or very few, will be even left vulnerable. That's just a wrong direction to take. We need to supplement our health personnel now to unburden them.
Okay.
And then you have your health services. So that's why we have all these things. Now, if you want to talk about the quarantine itself would look entirely different, because the pillar of a quarantine would be your identifying those who are sick, isolating them, and treating them. And that's why we were calling for mass testing at the start and a very efficient contact tracing. Is that going to happen under this MECQ? That's a very important question. Otherwise, we're just going to have another 2-week layover and nothing's going to happen. I don't see government, with all their recalibrated programming and whatever they're saying right now, actually making an extreme systematic approach towards mass testing and contact tracing, even in the areas where they declared MECQ.
Doctor, I get the impression that you think that 2 weeks will not be put to maximum use or good use by the government. But yesterday we had a talk. We've had talks with other doctors, and they're saying that, and some government officials, and they're saying they've reached the targets for testing so far, and they're going to shift to full testing using the swab test, and they're going to introduce the antigen test, which is more accurate than the rapid test. And then
Correct.
they're saying they're ramping up quarantine facilities, and they're putting the Baguio mayor in charge of contact tracing to improve things. You think all these developments are encouraging during the 2 weeks of MECQ?
Well, definitely yes. If they're going to do more massive, widespread, expanded testing, if they're going to do a more efficient contact tracing in the next 2 weeks, yes. But I hope it doesn't end there. We're probably one of the few countries who measure our quarantine every 2 weeks or every month. And what does that tell us? It tells us that there is no real backbone of a plan in terms of our entire COVID approach, of our pandemic approach. Because if we did have a plan, we wouldn't have to discuss every 2 weeks whether we're going to be ECQ, TCQ. We shouldn't have. We shouldn't even be in that type of a conversation, because what we should be looking at is where we are now in our COVID pandemic plan, in our response plan. And I haven't seen that in the last few months. So I'm happy if they're going to do this in the next 2 weeks. But after 2 weeks, where are we again? Are we going to discuss again what kind of community quarantine we're going to have? Will the entire approach to the pandemic response still be led by generals? I'm happy that if they can do that, but honestly, naghahabol tayo. We're trying to play catch up. We need to be ahead of this. And the only way we're going to be ahead of this is if we really have a good plan. And I don't think the generals will be the ones who can formulate that plan. Not now, not in the next 2 weeks, not in the next few months. We've seen what we've been doing in the last few months. Are we willing to risk the same thing in the next few months until the end of 2020? Already our health personnel are crying out and saying, look, this isn't working. Are we going to risk it again? Simply because they tested more? They contact trace, they did better contact tracing in the next 2 weeks? This is a call to revisit what we have been doing, not just in terms of quarantine, not just in terms of testing, isolating, contact tracing, our entire approach to the pandemic. That's what we're
Doctor,
asking. Yes, ma'am.
Doctor, just by illustration, could you tell us some how can we improve the contact tracing and the quarantine and isolation?
Well, definitely, if you can test them. Well, right now, the data, if you test them, then you would know who's sick, and then you would contact trace. Right now, a study shows that contact tracing, that the level of contact tracing is only up to 4 to 5 people beyond the patient. That means their immediate family lang. What is the World Health Organization saying? Your contact tracing should involve from 10 to 30 people outside your index patients, and all of them have to be tested. We are not there. We're so far from there. Now, who do they want to contact trace to do the contact tracing? Is it going to be, sabi nga nila, mga sundalo, mga state security forces? Where are we there? No, so we need to really have a good plan. Who's going to conduct this? How prepared are our barangay health emergency response teams, the BERTs? These are the people who are in your communities, in barangays, looking for who the cases are. And part of the work is not just looking at who the vulnerable population is and who might be exposed to the disease, but also part of the work is looking at those who do not have COVID-19 but may be vulnerable to it, or those who may not have COVID-19 and not been exposed to it but may need other non-COVID related health services. Malaking gawain yan. Right? So yun sana yung mga tinitingnan. So you have testing, you have contact tracing that is at least commensurate to what the World Health Organization recommends. And then how are you going to isolate them? If you're looking at communities that are densely populated, kaya ba ng LGUs mo mag-provide ng quarantine facilities? At paano gagawin natin sa mga families who where one family member is quarantined, paano mabubuhay yung may iwan nilang pamilya doon? Lalo pa ngayon na naka-lockdown na ulit tayo, usapin na naman yan ng buhay kamatayan kung wala kang kinakain na araw-araw. Those things need to be addressed. Otherwise, people will go out. And people will look for ways to survive.